Okay, Assalamualaikum warahmatullahi wabarakatuh. Glad to meet you all back. See mostly all the familiar faces lah. Okay. So first of all, macam agak nervous dan this journey and this trip was very emotional and it's a dream come true for me and my husband. Okay, to come back. Okay, and we are glad to have Prof together with us. And I think Prof already made us clear that there's a lot to catch up. Okay, before you enter your husbandship. Okay, and also I would like to thank the committee for their effort on organizing this symposium, and then for your warm hospitality during our stay here. Okay. So, can you have the, tak boleh lah, saya tak guna sangat pun, tengok muka tu. Okay, so how many of you are excited to know more about Malaysian system? Okay, belakang tu tak angkat, tak apa. Okay, more importantly is I want to share how to prepare to fit the Malaysian system better. Okay, so thank you and congratulations for choosing to be here. Dan saya difahamkan yang sepatutnya kita ada 200 participants, but because I use the main hall in main university, so the committee have to cut the total participants into half. Okay, so you are the chosen one lah. Okay. So this session and the further session will be more interactive, sharing. So you all can stop me at any time if you have any question lah. Okay. If an appropriate, I'll answer directly, or if not, I will pass to my to Prof alphabetically. Okay. Okay. So I know that most of your concern are regarding the course and the HO housemanship. Okay, but to be fair to the juniors, kita takkan dwell very detail to HO lah, because we will have house officer preparatory course in September, inshallah, for the 6 years. But we will cover the major things lah, without the practical skills, everything. Okay. And then for me, what is more important during our symposium is how you can what to do, what to improve yourself during your study years in Russia. Since your Pak is the preparatory course, pre-clinical lah. And during your study at first year, second year, third year, how we can study, what you can do for you to prepare. Okay, so that we have more or less the same knowledge as Malaysian student lah. Okay. Okay, so we'll be comparing Malaysian, Russian and Malaysian medical education, and see kenapa dia berbeza sebenarnya. Okay, then you will understand that it's not the Russian system is not good, but it's not meant to train Malaysian punya housemanship lah. It means to train the Russian internship. Okay. Okay. So we don't want this program to be a macam touch and go. So I think sekarang you all have dah macam ada motivational boost, macam wah nak macam got this noble intention. We want to come with a set of activities or activities that you all can do, that we can help you to do, to help you to gain the same knowledge as Malaysian. Okay, HO prep is another lah, dah sampai dekat situ grad kan, there's nothing really much we can do, but for student there is actually banyak sangat yang kita boleh buat sementara you are still a student lah. Okay, so let me share a story first lah. But let me introduce myself first. About yang saya kenal is 5th year and 6th year. Okay, my name is Siti Iliana binti Mohamad, wife to my husband, Dr. Limi, a full-time mother, full-time housewife, and a part-time doctor. Okay, part-time doctor. Okay. Okay, my CV is not that remarkable as Prof, but insyaAllah akan catch up cepat. Okay, insyaAllah just starting to further my study to become the most non-popular specialist in Malaysia, which is primary care. Despite Prof punya advice, I still want to be a family physician lah, that I have found my patient in that. Alhamdulillah. Okay, so I share a story. It's a so that it's a beginning for me to understand the Russian and Malaysian system well lah. Okay, so medicine is also not my first choice. Okay, despite macam ayah cakap jadilah doktor, dulu ayah tak sempat jadi doktor because my father is an army officer. So dia kata kalau kerja jadi doktor dengan tentera nanti kena tinggal family berbulan-bulan because kena tolong orang Bosnia lah whatever. So he decided to take engineering instead of medicine. Okay, so bila I was a MRSM student, then bila nak choose the SPC, then my friend said nanti kalau kita kerja engineer, perempuan tak ada orang nak hire, so okay lah doktor je lah. Okay, and then I was not a really student yang rajin to go through. I know kalau you pakai SPC, you buat magic, you mesti pergi Russia. There's no other choice lah. Kalau you nak glamour sikit, go to England ke apa, you have to go through IB A-level, which I found myself not so hardworking for those macam susah sikit ni program kan. Okay, so I want to cut the way short. Okay, okay, so pergilah Russia. Orang kata susah tau pergi Russia, and never mind, dah tahu susah, okay kot, nah macam tu. Then when I come, then I was a third batch sponsored by government lah. So bila being a critical person from the first place, so I was wondering macam tak berapa okay je Russian system ni. That was my personally lah, because of the rumours also lah. Dia cakap kenapa why government are sending to Russia apa semua, it's just to save cost lah bla 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 bla. Okay, so I pun macam I have this belief that it's not really good lah, walaupun kerajaan hantar. So dengan beraninya, at our time we was not obligated to do summer practical. So sendiri saya pasal pergi buat practical. So it was my second year. Second year means we are not clinical student yet lah. Okay, belum belajar terapi, we just finish our basic science. Okay, so I applied for hospital Selayang, but tak dapat because full. So I have a cousin who is a family physician in the HUSM. So she said, apalah, never mind, come and join my student and see how we do things and everything. So So pergi. I joined the third year. It was they just started the hematocycle lah. So pergi tengok budak Malaysia belajar ni, it was very macam, dekat Russia ni you have to learn everything by yourself. Pergi lecture pun macam faham tak faham sangat. Okay, baca buku pun macam faham tak faham sangat. Russians need to be very independent lah. Which bila dekat lecture tu macam I can grab the things I have to study the whole week in half an hour. So macam lecture tu pun do you understand? Kelantan ni kan, you understand? Do you understand it means just one whole lecture within 1 hour I can macam fahamnya, macam boleh tanya soalan lagi macam bestnya. And then after that you got PBL, practical how to club patient, means it was so easy to understand. Macam okay, macam maksudnya then I come to conclusion macam Russian system memang tak bagus lah. I come to get conclusion. So when I come back, I decided to quit. Macam cari jalan lah nak masuk CSMS. Calling up our person in charge in Malaysia, Miss Penny, I want to quit. Russia is not good. We won't be a good doctor if I pass the Russian medical school, I think. Then if anyone knows Miss Penny, she's very macam remarkable and macam ada. And she said, Iliana, I'm sorry but you cannot turn back. You cannot turn back because you tak ada level, you don't have IB. If you turn back, you just have your SPM. Okay? So it's waste of time, blah blah blah. But Miss Penny said something very macam convincing. Then I said, it's not fair for the government to do this to us. We are macam selected student lah, blah blah blah. Why send us to macam deserted, blah blah blah. Miss Penny said, okay, there's a reason why government choose very selected student and send them to Russia. Macam my batch, all the JPEs are macam the best student of the state. Abang Pui best student of Johor lah, best student of Kelantan lah, Negeri Sembilan. All the best student, the state best student go to Russia for some reason, tak tahu kenapa. They said because we are very sure you are so excellent, you can survive the medical schools without the pre-med. Okay, so actually Miss Penny said, yang A-level ni, IB ni macam geli-geli je nak suruh you all, whether you can stand the stress of medical school. So kalau if we have chosen very bright, very macam pandai sangat tu, so there's no doubt you will survive your medical school in Russia lah. They take the risk. Okay, so that's a turning point that I have to accept. Okay lah, I'm fated to be here. Okay, then I start to meneruskan usaha-usaha yang macam balik buat lagi practical and got batch with the specialist tak pun, because I want to know how Malaysian student learn and what is apa yang penting bagi diorang that is not available in Russian medical education that I can complement myself lah. Okay, so all the juniors we started macam perasan when you datang, I'm so excited about buat kelas tambahan sorang-sorang waktu raya. The next hall is tengah makan, the next hall is a CME by me. Got few student because I know the needs of it lah. Okay, so dapatkan moral of story. Since you already got the moral of story from punya talk, but I just want to show you how critical it is. Okay, I know kita belajar kat Russia ni it's not easy, but when you study, it's not just to pass your course. Okay, you need to do more. Then you need to do more. You have to strive more. But the fun way lah, macam Prof cakap kan, macam we need to create a good, conducive, fun learning environment that yang tak ada dekat sini, so that we can be as good or far better than Malaysian punya student, because we have the Russian technology to bring back to Malaysia lah, and also we also have the knowledge that Malaysian students have. Okay, are we good to go? Next slide please. Okay, so okay, I will just compare Russian and Malaysian punya medical education system lah. Okay, for the preclinical years, before you start your therapy, macam seeing patient, Russian use a conventional versus block system. Okay, conventional means you learn anatomy by anatomy, biochem by biochem. So anatomy, you learn the bone first, then the muscle, then by the time you go to your muscle, you already forgot your bones. By the time you go to your heart, you already apa tu, dah lupa yang belakang tu kan. Okay, but Malaysian, they use a block system, means you study a system, you study the CPS, you study the anatomy, physiology, everything together, so that is much easier for you to understand lah, because it's macam related lah. Okay, okay, so Russian system need the student to be more independent. You have to study everything on your own. If you gigih lah nak study, okay, stuff very little yang akan just get away from it. Macam okay, macam tak nak lah, just follow the flow. Okay, that's very little lah. Okay, but memang ada student yang macam tu in a few batch lah. Okay, and then it is very lecture dependent. Okay, if you anatomy, the first time you're with lecturer yang macam ajar gila, then you have a very good knowledge about bones and muscles, but the next time you don't know nothing about like apa tu, CBS ke apa, because very lecturer dependent. Okay, okay, next, and then it comes to macam we are lagi banyak mengingat without reasoning and understanding. Okay, because the classes are structured for you to answer your lecturer according to the macam tutorial given, which the tutorial is a Russian translated to English, which you can macam tak berapa faham sangat. Okay, then you boleh akak, okay, your name in the class is the third one, so more probably I get the third page punya question. Okay, so I remember by heart the third page lah, third page. Okay, so you don't bother whether your friends are answering apa, your teachers are apa ni explaining anything, just asalkan kau dapat jawab, that's it. Whether you jawab 3 ke 4 ke 5, it doesn't matter lah. Then bila habis kelas, okay, that's it. You don't really get the understanding or the total topic on the first place lah. Okay, so it becomes macam certain people yang very hardworking, yang dapat cikgu yang semangat ajar, you go too deep into the topic. Macam, wah, aku nak jadi anatomy lah macam ni ya. Macam aku dah tahu banyak sangat pasal anatomy konon-kononnya. But on the other side, macam ada certain orang yang go with the flow, and then tak dapat lecture yang very good. They will just tak tahu. Aku macam, aku tak baca, I don't know nothing about apa tu, macam nephro, the kidney, macam certain system are very good according to your lecturer, then another we become very lecture dependent. Okay, okay, and then of course because you are in conventional, there's a lack of interdiscipline or a clinical correlation. Okay, you go too deep during your preclinical years. When you dah masuk clinical years, you don't really remember Krebs cycle lah, the RBC form lah, apa semua you dah tak ingat. Ataupun if you try to remember back the practice, macam third year therapy, you baca hepatitis 4 year, hepatitis 5 year, hepatitis 6 year, hepatitis, what you learn is just the practice balik and the classification, because you ingat balik sampai situ je you boleh study. Then the management semua you tak, not really into it lah. bukan you lah, we all at that time. Okay, maksudnya for me also, I find I keep repeating the practice and the classification. Bila nak belajar management ni macam kan. Okay, next. Okay, and then clinical years. Okay, so during clinical years, okay, to understand the clinical years punya apa ni difference, we have to understand the structure of internship in Malaysia and in Russia. Mungkin setengah, most of you didn't know that I only started to realise this during my 5th or 6th years. The internship in Russia is very specific. Maksudnya kalau kat Malaysia, you jadi houseman is internship lah. You jadi houseman, you kena lagu medical, surgical, ONG, PITS. Mean you have to know to manage how the common cases in every department, everything on earth. Okay, know how to manage, or at least know what to refer, how to restart first before referring. Okay, but internship in Russia are very specialized. Maksudnya you habis medical school, before you finish your medical school, you have to decide which department you want to do internship. ENT ke, or NG ke, even therapy, gastro ke, pulmo ke, cardio ke. So yang lain-lain tu they don't have to know. Okay, that's why the clinical years in Russia are meant for macam nak bagi exposure je. Kalau ENT, got disease, itu je. They macam, it's not in their, bukan tanggungjawab dia orang untuk ajar how to manage this, which one is important, this one is common, this one is not common. Tapi they don't really dwell into the management. Okay, because their interns don't have to know that. They only need to know the management if you are intern in the department. Okay, so kalau you nak, if you want lah, because we need to know the management, you have to go extra miles to catch up the management. Okay, whether you learn Malaysian way, or then you have to compare the management by asking or joining additional practicals with your lecturer, or I will give some some apa ni, contoh-contoh apa yang you boleh buat. We can try to do so that you can grab the knowledge also. Okay. So how can we improve? Okay, knowing that these are the differences. Okay, first it should start from your kita punya attitude toward learning. Okay, we are so used to the system that kita belajar untuk jawab dekat lecturer. Okay, kalau lecturer tak tanya sangat, you pun tak payahlah belajar sangat. Kalau lecturer tu garang sangat, then you akan belajar macam okay. So please please learn for the sake of knowledge. Okay, because you need this knowledge to become a good doctor. Okay, you will have to carry forward the knowledge to your clinical years. Okay, bila you start housemanship pun, most of the frequently asked question during what round is for the physiology, yang semua houseman macam then only the medical student yang join round tu can remember kan. Houseman dah macam tak pernah belajar je dulu kan. Okay, so and another thing is you have to know what kind of learner are you. Okay, ada certain orang is I'm not good at reading, but I'm good at listening and making notes. Okay, so you have to know what kind of learner are you. Are you macam yang suka dengar, atau are you suka yang dengar and tengok lecture, or you are kinesthetic, means you nak hands on, you nak buat eksperimen, you want to go to touch patient. Unless you touch patient, then you takkan faham lah. So but a good medical, a good education is the one yang combine everything. Okay, so you see, you hear, you touch, you tell, you teach others. Okay, so that you akan understand. Okay, so that we will try. If memang these things memang not really provided by our traditional Russian punya education, then if diorang tak provide, then we can create it ourselves. Okay, nanti saya akan bagi this off ni lah. Okay, and another thing which is I find very important, especially for the junior student, is how to optimize our primary source of knowledge. Maksudnya kebanyakan kita ni our primary source of knowledge is the tutorial, and then senior punya notes yang macam dah nampak tak nampak. Okay, susah, ada pusing kat atas, pusing kat bawah, ada gambar orang pis, ada chalk lah apa, ada few names dekat atas tu kan, setiap batch punya names ada. Okay, and apa tu, and exam punya skema lah. Okay, made by the seniors, but we have to understand this is not a primary source, that is secondary source. You take that from another person, so you tak ada kefahaman yang core to that knowledge. The primary source sepatutnya is your lecture. Okay, your lecture, ataupun you read books and you make your own notes, ataupun, but that one is susah nak dapat. Okay, susah nak dapat, ataupun you have to go extra miles to understand, that comparing few books apa semua. But masalahnya is the lecture lah. Selalunya kita ni, we don't really appreciate lectures, betul tak? Okay, maksud you mula-mula datang tu, you macam tak faham accent you pergi lecture, then you don't get a habit to macam salin kan. Then macam tu lah, when tak ada habit macam tu, you pergi lecture just for sign, and then read the topic for the next tomorrow class kan. Okay, so actually we should learn primarily from the lecture. Okay, we should learn primarily from the lecture, and the best way to learn is for you to study before the lecture. Okay, kita biasanya kita akan tengok topik-topik apa ni, topik-topik kelas kan. Okay, first class belajar apa, second class belajar apa. Actually kalau you perasan, kita ada topik for every lecture. It's better for you to read before the lecture, so that you can understand the lecture better. Then you can start ask question. Okay, so by the time you nak ada cycle, ada kelas tu, you already have a good understanding about the team lah. So lepas tu kalau you nak guna ada apa tu, secondary source macam senior notes ke, apa ni, exam schema ke, then tak apa, because you already have the understanding. Then you complement it to meet your lecturer punya need. Okay, so bila you dalam cycle tu baru you tahu, this lecturer suka tanya macam ni, or this lecturer doesn't actually ask anything at all, masuk. Okay, hari ni kita belajar ni, I will come back in 5 minutes, then dia datang sampai habis. The rest of class is the pre-read, rehat kan, balik. Okay, so you belajar macam ni. Okay, so that is how things actually should be done. Okay, bukannya macam study untuk kelas je. Okay, dah habis kelas, you actually not, you tak faham sangat pun, tapi dah habis kelas. Why I should bother to read back or understand back that topic kan? Okay, okay, next. Okay, okay, so okay ke? Okay, are you following? Okay, okay, so first is I find we have to start to appreciate our lectures more. Okay, start asking question more. Okay, okay, and then what's more, next is I find this is very important. Bukan masalah budak Russia je, even budak Egypt pun dah 5 tahun, 6 tahun belajar kat sana, still I was surprised they cannot speak Arabic, even belajar despite learning in university. Okay, problem is, memanglah you cakap tak apalah, duduk dengan orang Malaysia apa semua, but if you don't know the native language, it will apa tu, stop ataupun menghalang you to club question, ask question to your lecturers. Memang kita punya lecturer, they know English, but they know Russian better. If you can ask in Russian and you can understand Russian very well, diorang akan macam okay, tapi masalahnya we don't ask and we don't understand Russian really good lah. Okay, and okay, and communication skills, okay, means your interpersonal skills, because being a student you macam student, macam you don't have macam a good relation with your lecturers, okay, then this is one of the major problem for houseman. You kerja, you rasa macam you just another student or another worker, then macam prof cakap, actually your bosses, your superior is another human being. So dia suka macam you macam yalah, do something they like lah, okay. So kalau you start to build relation with your lecturers, then there's a lot more that you can learn from them outside or inside the class lah. Okay, I mean kalau you tahu macam certain lecturer tak suka explain because the English are not good, okay, but you can ask macam diorang tunjuk patient ke apa ke, okay. Most of the lecturer are macam helpful, providing you ask, okay. I'm not sure whether many of you know about Krujok. Okay, I've mentioned this during the junior doctors punya program last summer break. Okay, some of your seniors was there. Okay, Krujok ni dia macam CNE for the Russian, because for the Russian student, in order for them to get their place of internship in the department, they have to have a good CV with the department lah, macam good relation. Okay, maksudnya dia nak buat ONG, they have to know they have to macam compete for a placement in the MO, in the ONG. So they have to join this Krujok, macam present paper ke, macam apa ni, it's macam CME, but when they are involved with the Krujok, then the department and the lecturer will know them, okay. Then barulah dia orang boleh buat internship kat department tu, okay. And it's in the Krujok that actually they discuss about the management, okay. Memang go into detail the option apa semua, macam mana all the evidence base will go out lah, macam will be revealed at that time. And then the lecturer yang in charge of the Krujok ni pun is the lecturer yang very passionate to learn, macam tahu Russian classification, classification yang belum keluar lagi pun dia dah tahu, macam dia intentional, they are very good at it because they love to teach, okay. So macam bila you ask nanti mostly MO atau specialist yang in charge with the CME are the one who's very passionate to teach, tapi husband tidur, dia seorang-seorang kat depan kan. Okay, so when you are new to the department, you just macam pergi kat cikgu tu macam, oh do we have Krujok for this cycle kan, what we macam Krujok ni buat apa semua. So you can join and you can learn the Russian management of that disease, and that is something you have to bring back, okay. Bukannya macam dalam Malaysia punya management tak tahu, orang Russian management tak tahu, so you lose both system, okay. It's something yang that's something we are expecting you to bring back, okay, because Russian are very macam some few things that they are good at is macam the homeopathy medicine develop evidence base. So kalau dia compare, okay, traditional drugs, the homeopathic drug, all the safety profile ada and all the evidence base semua ada, means which is tak ada dekat Malaysia. Kat Malaysia apa ni ubat homeopathy ni semua tak selamat lah, waktu we damage the patient kidney lah apa semua macam tu kan. And then the homeopathic doctors pun one dapat je, tak payahlah jumpa doktor dekat hospital ke klinik, dekat sini je dah cukup, lagi bagus, lagi selamat, lagi semua jadi whatever. Okay, but Russian punya is different. They are very open to macam physiotherapy, anything that macam evidence to bring good, macam benefit the patient. Okay, we will go for the best as long as it's evidence based. Okay, tapi orang Malaysia ubat macam kalau dia macam senior physician pun ubat je mesti ubat, pakcik tak makan ubat tak boleh apa semua macam. So that is something yang good for you to bring back. Okay, okay, and then read their medical journal. Okay, sebab our lecturer, our HO, Zaf Kafedra, all are very very remarkable macam people in their field. Macam kalau you tengok ONG punya apa tu medical journal, but in Russia lah, yang Russian punya ONG annual apa journal, all jarkin kan. Tapi kita tak bother untuk baca pun. Okay, then bila you tengok tu, then you akan tahu macam the Russian punya medical knowledge is macam hebatnya kan. Tapi kita tak bother pun, buku yang kita kena baca pun kita tak baca kan. Okay, so you have to, that's why your punya Russian knowledge is macam kena bagus sampai you boleh faham, sampai jumpa makcik tu sampai macam you boleh explain, you can explain the disease into a layman term to a Russian. Okay, that's how your Russian should be good as that. Okay, then you boleh baca kan, I'm not sure kalau masih ada lagi the Dobry branch yang uni punya buku kan. It's a very good book sebab it's a medical books written by all the consultant to explain to common people in a layman term. Okay, so kalau it's very good macam especially for the junior years lah, so that you akan faham disease tu in a layman term and in macam medical punya somewhere in between lah, not really scientific. Okay, and then another thing that you have to develop is the noting skill. Noting skill means you dengar lecture, you can olahkan dia into a notes that you will understand, so that when you need to revise that topic, you don't have to go to your textbook anymore. Okay, macam peterminda lah macam tu. So when you have a call-out, macam you just tengok, okay, we dah revise the whole topic lah. Tak perlu macam so nak follow skema sini atau meja sini. That's not how we study. Lepas tu you habis follow, then you lupa, you forget everything. Okay, okay, and then please, ini pun sangat kurang. We don't really practice output learning. Okay, maksudnya you baca semua benda yang you boleh baca, you don't know what is already inside yang you dah tahu kan. Okay, what yang saya practice and I try to bagi tahu few juniors lah, and they find it very helpful, is we should learn practice output learning. Okay, macam you have a call-out kan, call-out macam it's an exam lah, topical exam. Okay, they will give us list of question kan. What I do and what I suggest you to do, if you see the list of question, then you try to recall what's already inside your mind. Okay, what I already know about this topic. Okay, then when you start recalling, then you will notice what you don't know. That is when you have to see your notes, atau you cari speech sini punya skema ke whatever. Okay, it's not okay, soalan skema, then you baca without really understand or macam tahu apa yang actually. Lepas tu bila masuk exam, I don't know what's inside my mind, macam blank kan. It's very common. Okay, so and another thing is when you practice output learning ni, it's a way for sharing kan. So you boleh cerita dekat kawan you boleh cerita dekat your punya housemate, your punya junior, then you will benefit, because when you start to teach, then you will realize what you don't know. Okay, then you can expect macam soalan yang your friend tanya tu is a common question yang lecturer akan tanya juga, betul? Okay, so it's a way to create macam a sharing punya environment, macam everyone tells another one topic. Okay, so that's another thing yang tak ada dekat, bukan tak ada lah, macam very lack And you belajar untuk diri sendiri, you don't bother, you pun tak faham, kawan you bagi lagi kita tak kisah kan, kawan kita faham ke tak kan. Okay, so when you start to share, then you will understand that senang je sebenarnya benda ni. Okay, and then I always believe that when you start a good thing, it will spread. Okay, when you macam you start a good things, then benda tu akan bercambah. Okay. 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 So that is macam the principle or apa yang we can improve how we study. Okay. Then we cut macam tadi tak adalah susah sangat, betul tak? You have to remember everything. You already have remember everything. Okay. So bila exam macam tak adalah tak boleh buat kerja lain macam, ataupun certain cycle yang selalu I'm doing the online CME with the 6 years lah, TP ke DM. Tak boleh lah macam selalunya orang macam tak boleh lah, busy lah, cycle busy. Cakap apa yang busy ni, you should have know the you terapi tu dah 3 tahun, takkan you nak have to study juga benda yang sama kan. Okay. Okay. And then okay, so these are my suggestion, okay, ataupun way of improvement, and when we can apply all those yang saya cakap tadi lah. Okay. Okay, first is optimizing your summer practical, since you memang wajib kena buat summer practical walaupun, and then saya difahamkan memang setiap year tu ada department yang macam this year start daripada second year, first year dah kena buat second year lah. Okay. First year dah kena buat kan. So ni edit sikit lah kalau first year you have to go to, because the problem is when you go to hospital, they expect you already a clinical student. Okay, maksudnya you dah tahu the basic disease, you already know how to clerk. Okay, tapi first year is actually nursing punya practical kan. Tapi saya pun macam how to macam mana nak bagi first year can understand what they are doing in the hospital. So mungkin dia orang, I haven't sit macam properly untuk come with the good solution for the first year and second year. But at least mungkin you boleh bagi emergency where there's more procedures, betul, when there's a lot of procedure you can do and you can understand the flow. Okay, and then of course the best is if your senior can macam explain you sikit-sikit lah disease apa semua, the common things you will find in the department apa semua. And then and for the senior years, even kalau macam you're supposed to do macam surgical, tapi you went surgical department penuh, then you have to pergi department lain. Ada orang dapat second year ENT, which is macam okay. So we have to find ways for you to optimize, macam make full use of your summer practical lah. Okay, one of the good suggestion if you pergi to teaching hospital. Okay, so you can join the student studying, and then the student boleh they have a ample time to teach you. Okay, then also you boleh tengok how they study lah. Kalau you can ask for the lectures apa semua, so that you can learn back in Russian. Okay, and then I have the during my 5th year, if I'm not mistaken, at that time macam susah sangat nak buat practical. Macam diorang macam tak nak accept, all the hospital tak nak accept unless you're someone in the hospital lah. Then I managed to do in Hospital Putrajaya under Prof Latif punya assistant. So I find that one is very helpful. Okay, macam because you are guided, you are assisted, okay, what to do, then how to actually clerk, how to actually present back. Okay, so your summer practical should be your macam kita punya trial of housemanship lah. Means you know what's really going on dekat hospital Malaysia semua kan. Okay, then that is when you need to practice clerking and presenting, which is what you normally do as a houseman and future doctors lah. So you engage on ataupun in your department. Okay, next. Okay, so and another important point is this one, to create a conducive and supportive learning environment. Okay, this one I can only suggest, but all the things yang saya tulis ni is up to you all. If you really want to macam nak buat, then we can actually guide or lend a hand. Tapi kalau you tak nak, macam we cannot spoon feed you. Okay, sebab you yang nak buat, you nak jalankan benda tu. Okay, next. Okay, and then engage with the activities that can complement your undergraduate knowledge lah. Okay, for example, next. Okay, familiarize with common diseases and its management. Okay, this one, kalau HO prep, our HO prep module, we will list the common diseases you encounter in every department, together with the common drugs you akan jumpa, and all the guidelines, all the abbreviation yang common. That one is also available in our junior doctors punya module, I believe. Nanti tak? Okay. Nanti. I have a soft copy. Nanti I will share with you all. Okay, so that one is untuk HO prep. Right, maksudnya saya akan advise, okay, this is the common diseases, then you should start, bukanlah study macam recalling back, okay, this is how, macam mana you manage, okay. But during your study years, you can use the same list of disease, so that bila you therapy, you know dekat Malaysia what is common in Malaysia. Okay, and then the common drugs pun, because when you learn pharmaco, kita learn pharmaco third year kan, you selalunya tengok macam all classification, then you tak ada masuk untuk go to individual drugs, apa dia punya betul indication, contact indication apa semua. So if you have a list, then at least the list, then you know which one yang important in your in your practice lah. So it's one way to bring the practice into your clinical years. Okay. Okay, and then of course during so that waktu you tak terapi tu, then you tahulah, sebab kalau kita punya terapi, biasanya kita akan ulang disease yang sama, year 4, year 5, betul tak? So you have to get to know another common disease yang nak cover lah. Okay, macam dengue, TB apa semua, and also we'll try to help with our online CME apa semua. Okay, and then another things is workshops. Okay, workshops, I'm not sure whether masih buat lagi macam PE, physical examination workshop. Okay, we used to do this during my 5th and 6th years. Okay, then the senior belajar, it's actually what I learned from my summer practical. I practice it, then I bring back to teach others lah, the SIPO and CBS. So actually tak ada susah sangat, because we already learn the physical examination, tapi macam there's a few steps, it's more systematic and macam organised lah. Okay, and then how to clerk, how to present. Okay, I will try to cover tomorrow morning very briefly, so that you have a macam career, macam bila you pergi practical, macam that is the most, macam biasanya you all punya concern lah, we don't know how to take history, macam tak tahu nak tanya apa kan. But then kalau the MO suruh present, macam you tak tahu kan. Okay, and then a basic procedure ni we will cover during kita punya HO prep lah. It's good to know how to do procedure during summer practical, tapi itu bukan dia punya main concern, nak masukkan granula lah, whatsoever. You kalau tak dapat pun tak kisah, you want the knowledge of management dan how the department works is more important than studying granula apa semua tu, which you can learn within few hours during your housemanship. Okay, kalau you try pun, then lepas tu setahun you balik dekat Russia, then you tak practice, you will forget it anyway. Okay, but it's good to know lah kalau ada chance. Okay, next. Okay, and the last one is the such symposium and courses where you are updated with apa ni, current issue in Malaysia apa semua lah. And then looking forward to meet you all in the HO prep for the Russian lah. Okay, in September insyaAllah lepas raya. Okay. Okay, I think that's all from me. Ada apa-apa nak tanya or suggest or so? I hope that MSA or Imam, I think you all dah already have the academic bureau apa semua, but someone has to take initiative to start this thing back. Okay, then you have to catch the juniors also. Okay, sebab ni banyak yang senior kan. 6 year siapa? 6 year. Angkat lagi sikit. 6 year, okay. 5th year? 5th year. 4th year? Okay. 3rd year? Good. Kesian junior dua kau, kena bully ya. 2nd year ada? Okay. 1st year? 1st year? Yeah. Okay, so you have to catch them back. Tangkap lah macam mana, ajak makan dia tak minggu ke belanja ke apa. Because if not, they will get to this bad habit. Bukanlah bad, macam not so excellent habit. Then the vicious cycle will then bila you dah macam, kalau sisi ni sebab dia takut houseman jadi dia datang. Kalau itu macam you are so used to what kita dah biasa buat, then macam yelah mungkin kita buat tapi tak pernah nanti lah. Okay, so we come all the way I come all the way to talk to you sebab kalau buat program waktu sama, I tahu macam nak kahwin lah, nak tu orang lain nak kahwin lah, apalah tu semua lah. Tak nak mak masak tu hari ni, mak masak ni, susah nak jumpa. So kita you susah nak jumpa, then I will come to meet you all. Okay, so you dah ada kesedaran. Okay, you dah ada kesedaran, then kita dah ada orang yang nak tolong. So please start to do something lah. Okay, yang 6 year lah, 6 year dengan dia punya course tu. Tapi yang junior year, please, kita ada macam there's a lot of things yang korang boleh buat tau. Macam I understand kita kena belajar, tapi we have to start to do extra lah. Means then buat sama-sama, so it won't be that macam susah sangat. I will always be in Malaysia or here to guide, and then insyaAllah I think Prof pun akan really glad to help. Okay, if not he wouldn't bother to come here. Okay, so we can start the Q&A lah. Ada apa-apa nak tanya?
Baik, apa ada soalan? Assalamualaikum warahmatullahi wabarakatuh. Saya Atik Umar, insyaAllah akan grad dalam bulan Mei. Jadi saya ada 2 soalan. Mungkin boleh dijawab dekat Iliana ataupun Prof Latif lah. Yang first, sebab especially untuk sisi lah. Maksudnya tadi Iliana kata ada pre-HO punya program, tapi tu dalam bulan 9 kan. So in meantime, kita orang cuti selama 3 bulan before start working. So can you suggest what we can do? That's the first question. The second one, ataupun memang patutnya kita take time untuk relax, full relax. Second question, kan cakap tadi, actually there is something good that from Russia actually, but is it really we can bring back that good thing to Malaysia? Because I think kita balik Malaysia, kita kena ikut juga sistem Malaysia. Masuk Asia, sistem Malaysia juga.
Okay, yang first tu, kita boleh there's a lot of, yelah, HO prep tu is betul-betul, actually HO prep ni, the good things in it is we allow you to practice macam mana class, okay, and then hands on with all the hands on the basic procedure yang you kena buat, okay, and then we teach you the shortcut way to physical examination as a houseman, which is tak boleh ajar dekat medical student lah, nanti you shortcut terus kan. But in the meantime, you boleh guna kita punya program book tu, then you can start teaching your juniors, you can start familiarize with the clinical practice guideline yang Malaysia punya, okay. Then after you punya course lah, kalau the common things yang ada dekat, yang included in your punya final course exam tu, you can start to compare the management lah, because yang last year punya yang grad pun dia cakap macam biasanya you punya lecturer concern macam dia punya soalan is how things are managed in Malaysia, which is tak ada right or wrong lah. Maksudnya kalau you bahasa pun dia orang tak tahu lah, bukan lah, tak suruh you bahasa, maksudnya they want to know how things are done in Malaysia, okay. So if you prepare for both Russian and Malaysian, it's a plus for you lah. Okay. Lepas tu apa? Lagi satu soalan tadi. Oh, banyak apa? Memang waktu if you are houseman, memang you tak boleh, even MO pun you have to follow your bosses, you especially you have to follow your consultant. Tapi it's good to macam knowledge is for you, then later on macam you boleh guna kalau you follow apa tu yang Syamirullah punya. Actually the common practice is to follow what ni lah, kadang-kadang Malaysia pun doesn't really follow the clinical practice guideline juga, okay. Even KK ke hospital macam suka hati specialist kan, tapi it's good to know, macam you yang tahulah, you know the basic science of it, and then if you're strong enough, you boleh je implement. Macam memang walaupun they don't want to accept it, that is the the sebabnya on the first place diorang hantar student pergi kat lain, selain daripada tak cukup seat untuk medical seat in Malaysia lah. But memang as long as it's a knowledge, dia memang akan benefit. When and where tu, ni lah. Okay. Prof nak tambah ke?
Saya maybe Assalamualaikum. Nama saya Aizat, pelajar tahun akhir. Jadi saya nak tanya sebab ada sebelum ni saya baca dekat artikel kat blog apa semua rumus yang mengatakan bahawasanya kita mempunyai lambakan doktor dan kemungkinan tak ada tempat. Tu maybe sikit sebanyak dah diterangkan oleh Prof Latif kan, pasal availability of posting dependent on the ada tempat lah. Dan saya juga dengar bahawa sebelum kita nanti ada sebelum masuk HO tu ada exam, ada entrance exam tu HO. Even MO pun saya dengar sebelum lepas HO, sebelum masuk MO tu ada exam lagi. Adakah rumus tu betul ataupun tidak, ataupun kalau ada apa yang kita patut prepare lah?
Saya jawab sikit sebagai dekat Prof lah. There's a lot of rumors, but is sekarang ni tak ada black and white they announce. Tapi ministry pun sekarang dia kalau nak buat something dia macam suka-suka hati. Macam tiba-tiba okay shift, tiba-tiba flexible, okay hybrid, okay. And then memang tak mustahil benda tu akan jadi, okay. Because they macam Prof cakap tadi, they in a way they have to macam limit the number. Okay, once to and another issue is dia kata this grad tak bagus. So when you have an entrance exam, you dari Malaysia ke, you pada mana-mana ke, if you pass then you can practice macam PPIM lah. Then nobody will question your knowledge anymore. Okay, so that's why it is important for us to prepare for the Malaysian. Okay, waktu you baca ni you have to anyway, tengok apa yang budak Malaysia belajar, you have to grab the knowledge so that you are prepared for both. Okay, ada ke benda tu, then you already prepared. Kalau tak ada pun, you already have the knowledge, then you akan guna juga as houseman. Okay, yang MO tu is macam they said dia nak buat sekarang ni, bila you grad, you memang macam aku cakap, there's an act, you mesti dapat kerja. Dekat Malaysia ni is macam time based, macam you mesti lepas 2 tahun mostly akan jadi MO, then after few years you akan naik UD, you akan naik pangkat. It's a time based lah. Tapi they said dia nak buat macam marking of, bukanlah marking, macam houseman punya macam in every department, are you an excellent houseman, ordinary or less than ni kan, weak houseman. So you will carry this mark, then they will make MO post pun macam dah agak penuh, they start to have shift and everything. Then the department macam they want to make it a contract base. You habis houseman, then you have to apply for a job in new department. Then kalau you punya markah do you think any department will hire you? Unlikely kan. Even macam sekarang pun, when you come to another department, then macam people already know whether you are good or ordinary or bad houseman. Okay, so there's a possibility of that thing. Tapi I think Prof nak tambah ke? Oh, kemarin Prof ya jawab semua. Dua kan? Okay, ada soalan lagi ke?
Assalamualaikum warahmatullahi wabarakatuh. Nama saya Muhamad Hafiz. Soalan pertama saya ingin tujukan pada Prof Latif, berkenaan dengan penilaian terakhir. Saya nak tanya Prof, apakah common cases, apa kesalahan ataupun cases yang biasa dilakukan oleh houseman yang menyebabkan dia termasuk dalam profile ataupun dalam circle yang discuss tentang penilaian terakhir ni. Itu soalan saya. Soalan kedua saya tujukan kepada Kak Yana. Tak awak pun. Okey, ia berkenaan dengan, saya dah tanya Kak Yana kat dalam Facebook kan, tapi Kak Yana kata nak huraikan kat sini. Kadang-kadang saya ingatkan lah. So, mengenai optimizing the summer practicals. So, untuk summer practical saya ingin tahu, sebab certain summer practical in certain hospital, dia ada yang efisien, ada yang tak efisien. Kalau efisien tu selalunya yang saya lihat, bila masa dalam satu department tu dia bahagikan satu HO ataupun satu MO in charge untuk satu ataupun 2 student. But dekat tempat saya, contohnya di Hospital Subang Jaya, dia actually main lepas student macam mana nak ikan jalan gimana tu. So bila jadi macam tu, semua student dia jadi senang cakap tak tentu arah. Dia apa nak buat, apa nak ni. So tiba-tiba kadang-kadang MO datang, dia tanya, ni macam mana nak manage benda ni. Lagilah blank kan. Kadang-kadang in the end apa yang student buat, dia akan pergi buka case history yang ditulis. Bukannya dia yang tulis, yang ditulis. Baca je kat situ, oh budak ni ada case ni. Sebab kita ada macam diary ni, something that, yang so kita refill benda tu, tulis satu benda tu kan. So saya nak tanya secara detailnya, apa expectation daripada saya tak tahu HO ataupun MO yang bertugas tentang knowledge, dan juga apa expectation knowledge medical student, dan juga apa expectation MO/HO terhadap student untuk apa dia buat ketika masa summer practical tu. Tu contohnya. Soalannya. Terima kasih.
Okay, yang first tu actually memang betul lah, certain hospital akan tag you, put you under some specialist or MO supervision. Tapi macam tu pun doesn't guarantee that dia akan betul-betul ajar you. Okay, dia just letak nama je. But you can always, that's why you have to know what to expect. Okay, then you have to know apa yang nak buat lah, which is, macam dia cakap, they will expect you to know how to clerk and how to present the case. and then familiarize with the management lah, because biasanya dia orang tak akan tanya like high tech macam apa ni, question yang disease yang jarang jumpa. They will ask you common, okay, common management macam dengue, pneumonia, kalau medical lah macam tu. So you should know how to class and you should know how to present. Sebab itu is a basic thing yang harus nak, and then you can, that is so practically for you to practice tracking ni, tracking, presenting and physical examination lah. Sebab lagi senang you nak hands on. Then you, that's why I would suggest you to do it in teaching hospital, where you, kalau houseman atau ibu tu tak sempat nak ajar you, then satu, you can join their teaching. Second, you can ask them to teach you, ataupun betul tak aku club macam ni, betul tak is my sequence of physical examination good, ataupun you can actually ask them, can you show me the proper sequence of CVS ke apa-apa. Okay, tapi if memang I want to sit in macam betul-betul in detail, then at least kita boleh bagi you macam logbook yang if you're in this department, you should at least know how to manage this apa semua lah. Okay, but insyaAllah saya tak ada problem kalau you nak, when you come back, you just before started, then you cakap you masuk department mana, then we can assign macam, we have a macam senior, macam ada MO yang Russian Volgograd dekat department tu, then she can teach you ke apa semua. There's few things that we can help, but you kena ask for in person with me ke Dr. Dr. Haji Mawadah. If kita tak sempat, we will try to assign someone else lah. The best is kita orang yang ajar you, macam dia dah tahu, tapi problem is you start your practical first day, then you baru tahu you department mana kan, dia macam agak lambat sikit. Taklah agak lambat, then you boleh just give me a call ke apa macam mana, then at least we can brief you how the department work, atau assign someone yang can help you. Okay, that some of the suggestion lah. Okay, ada soalan lagi ke?
Okay, Bismillahirrahmanirrahim. Alhamdulillah, Alhamdulillah. I will try to answer something generally. The first thing that you will realize as you start your first day sebagai seorang house officer is that most of what you learn at medical school have got nothing to do with work. Because macam no one actually, ada tak houseman present bila jumpa patient dia, masa walk around dia kata, I would like to present to you this 34-year-old gentleman was apparently well until 2 days prior to admission. Tak ada masa nak buat semua ni. It's not presenting like you present in your examination. Every presentation is actually just a summary of why the patient is in the hospital. It is a service walk round. So this transition between medical student dengan the real world, you have got to do some adaptation. Mesti. When do you do this? The biggest mistake that all medical students buat adalah habis je, they want to relax and take a break. So they go for a tour dekat Europe lah, and then start to think about macam it's a relaxing few months before they start to work. And this is a big mistake. When do you go for a Europe holiday? When do you actually take a break? When do you go for a honeymoon? After your housemanship. What you want to strategize adalah there is a continuity between student days, dan jangan drop your momentum of studying and training after you finish your degree. Jangan. Kebanyakan orang yang kahwin, my student final year semua tanya, Prof, exam berapa hari bulan? Mak papa text me and ask me when is the exam. Saya pun tak tahu lagi exactly when the final exam is, tapi they are so concerned because they want nak book, they want untuk kahwin. Real, I mean I'm not making a joke, tapi betul, dia betul-betul plan nak kahwin masa masa habis exam je kahwin. Atau dah akad nikah dah sekarang ni, dia nak buat majlis perkahwinan itu saja lepas ni. You know what happens when people get married? You don't know. Then they plan honeymoon. Different before marriage, pergi ke Bandung untuk beli cenderahati. Faham tak? Okay lah, it's very expensive and glamorous to get married nowadays lah But this is what they do. And then on the first day of housemanship, dia dah tak ada mood nak kerja. And then they quit and then live happily. I don't know, not happily lah. Maknanya, and these are serious things. Maknanya I have parents yang kata, you as the dean, tolonglah pujuk anak saya, dia dah tak ada semangat nak kerja dan sebagainya. Because they enjoyed too much between the phase of finishing medical school and starting work. Don't make this mistake. Maknanya kalau nak kahwin, nak pergi honeymoon ke, sabar dulu 2 tahun dah dapat APC, pergilah, sukatilah. Take a break, take a no pay leave for a couple of months and go wherever you like. Keduanya, then the first point tadi adalah do what it takes to adapt to the suitability of starting work. Learn how to summarize your patients. Learn how to do a very quick examination. Learn what your specialist expect from you. First thing, apa dia nak? Bila buat orang tu, you can finish tak presenting your patient tu in 3 minutes? Boleh tak? Tak payah nak present, I would like to bla 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 semua macam tu. Tak mau. Mana ada orang mau macam tu? In real life, people don't do that. Only in medical school, you do that. So what do you do now? There are 2 things. Satu adalah learn how to pass your examination. This is what you do as a medical student. Number 2, learn how to become a real doctor. 2 different things, totally different. And you have got to, kita dalam CSMS, kita ada semester 10, which is the last semester, where we talk about life. Kita dah habiskan exam dah semester 9, maknanya you pass your exam dah. Semester 10 is just about clinical examination. Macam, it's an easy semester. So we talk about how you clerk as a houseman, how you write down notes. Saya bagi markah kat student based on your notes. Maknanya sim by, what to do. Benda yang betul-betul orang tulis atas note punya. Bukan lagi one whole case notes yang 6 pages, ada reference to article semua, tak ada lagi dah. Maknanya it's about being a house officer. Learn how to write good summaries. Because they never teach you how to write summary dalam medical school kan. But every day you kena tulis seen by doktor apa-apa semua, patient punya condition is well lah, apa semua, IO berapa, berapa semua, anything BP berapa, and then apa dia plan nak buat untuk hari ni, trace CT scan result, trace full blood count. Benda ni kena pandai tulis from day one. Never ever orang ajar benda ni in medical school. Kalau as a houseman, you spend half an hour to write 1 page, you will be miserable. Macam tak ada masa langsung nak buat kerja lain. The top students of university becomes miserable as a house officer. Top student dalam university tak semestinya top houseman, because dia tak tahu take shortcuts. Every small detail, patient ada Sister Joseph's nodule. Kau tak boleh tu. You hardly see it anymore in real life. Tapi ada Campbell de Morgan spot on the chest. What's the significance? Tak ada. Tapi dia top student, dia nak benda tu juga, cantik juga. Mana sempat buat benda ni? On a busy on-call night lah, you got no time lah tulis benda ni. What you need adalah what is important to know about this patient, so that I can treat quickly and discharge as early as possible. Tu je. Everyone ask you the same question tomorrow, every day. Doctor, bila saya boleh balik? Everyone wants to go home, but you cannot say nantilah doktor besar datang kita decide. Tak boleh. You must make your patients well informed about their disease. Sekarang ni pakcik masuk because of dehydration. Tahu, I don't care whether dia tahu apa tidak, awak dia ada sikit. Tapi pakcik punya urea dah naik sampai 17. Okay, kita bagi fluid ni. Bila kita berhenti fluid dan urea dah turun 8 dan below, pakcik boleh balik. Wah, pakcik tu so happy. Why? Because at least there is a plan. ada harapan saya ni nak balik, tak masuk kubur sama. You give them hope that they are going home. Faham tak? Pakcik ni masuk dengue. Bila pakcik yang platelet mula naik, hematokrit mula turun, pakcik balik, finish. Faham tak? Wow. Besok lagi, doktor, platelet saya berapa? Saya hematokrit berapa? They suddenly become a medical student. But treating them is fun when you leave the plan of your management to the patient, and you give them hope that they are going home soon. Waktu dia mula makan sup ketam lah, all the funny things, so that platelet dia naik. Oh ya Allah, bila platelet dia naik betul-betul, wah, platelet ketam ni memang work lah. Sup ketam, rebus pucuk papaya lah, whatever. You never learn dengue, but as soon as you go back, every other patient is a dengue patient. Like the common cases like community acquired pneumonia, macam is a bread and butter. Dulu masa saya, you have got to memorize like one full book of antibiotics, but now only 4 antibiotics. You either choose that augmentin ataupun augmentin ataupun tak ada, Uracil is already hospital acquired kan, Rosafin atau azithromycin atau erythromycin. Mana senang je sekarang ni, semua perlu penabur semua, maknanya. So you need to know what is favourite in the hospital. So when you learn this, then you look at the progress, then you become a very good house officer. Bermakna konsultan baru nak tanya, dia dah bagi jawapan. Then people wah, sebenarnya contoh lah, finish lah. You need another graduate from Cyberjaya University ke? Betul, dia say yes. Okay, regardless of where you graduate from, so naik harumkan nama CCMS. Okay, so forget about relaxing for the time being. After dah habis dapat APC, you go and relax and have a nice time. Pasal board examination, maknanya wherever you graduate from, UPM ke, USM ke, you need to sit for a board examination. Benda ni will not happen, I think, in the near future, because it needs cabinet decision lah, apalah semua everything. They have talked about this for 8 years, but still tak jadi lagi sebenarnya. So we hope that it will not happen. The third thing adalah, when you become a house officer, you jangan benarkan diri dibully without voicing your concerns. So now start a trend. Saya nak encourage house officer, kalau kena bully, kena seksa, kena panggil bodoh, kambing, donkey, write in Facebook, write somewhere anonymous ke apa ke, make your voice heard. Tulis surat layang kepada Menteri Kesihatan. The DG of Health religiously reads his Facebook messages. If you PM him, he will reply, insyaAllah, within the same day. Dan mungkin dia kata reply and ignore you, tapi sebenarnya dah terkesan pada hati dia. That's what we want to do. Bagi kesan pada hati dia. Although dia ignore you atau dia tak ni, memang dia very particular about listening to people. If any leader akan terkesan dengan suara rakyat dia, walaupun dia kata taklah semua, tapi memang ada kesan. So what do we want to do? We want to change the condition of housemanship in Malaysia. Kita tak nak houseman di Malaysia ni terus tertindas dan terpedaya. You think terpedaya? Saya dulu, I saw major mistakes yang saya punya colleague as house officer did, which caused the death of patients. But they were not extended, they were not punished, they were not asked to stop, tak payah kerja lagi, tak. They were treated as junior who needs training. Sebab apa? MO masa dulu and seniors masa tu rasa doktor ni semua penting, aku kena ajar dia orang supaya jangan jadi doktor yang haprak. Sekarang ni, HO lah terlalu ramai, macam yang ni, kalau dia buat silap memanglah dia bodoh, memanglah apa yang orang cakap tentang ni betul, apa semua. The perception of seniors have changed. Now you have to prove yourself worth of the profession. Dulu everyone is important and I have to train my juniors. We want to change back to the old times, yang mana semua senior anggap bahawa junior ni adalah orang yang perlu saya bimbing dan latih, which is what the medical profession is about. Sumpah amal perubatan Islam adalah I should treat everyone as my brothers and sisters and train the juniors to be good. You buka balik apa dia sumpah. people are breaking their oath because they are treating people badly. So you must voice the concerns of house officer. Kalau ada Facebook punya status yang houseman kena tindas ke, share. Supaya dia jadi viral. And someone will sympathize. And I am fighting this battle. I am a senior and I'm a consultant and I am a specialist and I am a dean of medical school, but I am taking sides. And saya take side of the houseman, bukan take side of the senior. And I try to defend house officers as much as I can in whatever ways that I can. I fight with the DG, quarrel with him, making him believe that macam, you know, it is not that we have too many housemen, but the attitude of our seniors against housemen is bad now. We need to change that. And remember, you will change. As soon as you leave housemanship, you will treat the house officer like you have never been a house officer dah. Ramai je orang first day of MO ship pun dah kutuk houseman dah, padahal semalam mau dia jadi houseman. And it happened to my student. I wrote an email Facebook. I commented on my student. Dia kata dia baru je jadi MO, dia dah tulis HO sekarang ni attitude apa semua. I wrote a very rude status on his status. I said menyesal ajar korang. Betul tak? How can you change attitude within a few days? I said almost, saya tak halal semua ilmu saya itu memang teruk habis lah. Tapi I said you were worse than this when you were student, but we were patient. Kami bersabar dengan korang ni, walaupun korang pun bodoh juga asal dia. Kalau nak kira lecturer kena sabar dengan student yang tak pandai ni, you know, I don't tell you the story lah, tapi mana kena sabar gila. But as soon as they become MO, dia dah macam tunjuk action semua. I hope you don't become a doctor like this. Tak worth it. We are in the same brotherhood. We are a team. We are family. We must treat each other as family members. Bukan perbodohkan junior kita, jangan. Never do this because you will hilang keberkatan dalam this profession. So yes, there are rumours and there are examinations as a house officer. You will have viva. To some people do viva just habis nak tentukan bila you habis tagging. Tagging is like macam you can't do anything. You are again as usual the lowest life. But you have to tag everyone, work from 7 o'clock in the morning and only 10 o'clock ke 11 o'clock when they allow you to go home, you go home lah. For every day, bukan hari ni balik pukul 10, besok balik pukul 4, tak. Every day and up to 2 weeks, you cannot go home earlier than 10 o'clock. And you got to follow some on calls apa semua without doing anything, just tengok the houseman buat apa. Okay, now I know how to be independent. There is a viva, then you move from tagging kepada a real house officer that you can be independent. Okay, satu exam dah. In the first 2 weeks, before you finish the posting, there is another exam, and they ask you some stupid questions, and one person decide whether you should extend ataupun you can finish your housemanship and move towards another posting. And this is a challenge. Your exam don't stop in medical school, and the exam is all about management. How do you manage dengue, platelets coming down, but the lady is pregnant, is going to abort soon, apa semua. Benda yang gila. It is like macam you hardly see in the ward, but they ask you some question and you need to know. And it's everything about management. Dia bukan tanya what is the difference between fine crackers and coarse crackers. Tak ada lagi. That you learn in medical school. I don't know why also they teach all these things. Maknanya I don't teach all these things in my training already. It's about management in difficult cases. And things yang sebenarnya kadang-kadang houseman pun tak tahu nak buat, dia tanya je, what is your best answer? When I'm in need, I will consult my medical officer. They don't allow you to answer dangerous management yourself, because as a house officer, you cannot make major decisions. They want this answer from you. In this, I will call my MO and ask what to do. You give this answer, you pass the viva, finish. Takkanlah semua soalan aku nak tanya mana aku tak tahu. But when it comes to become more difficult, this is what they want you to see, or want to see from you, because they want you to be a safe doctor. What am I so afraid of as a senior member of the team? That my houseman make a stupid decision and patient die. Without my knowledge, found out.
of course you will be scolded in the middle of the night. Apa nak kau panggil aku pukul 2 pagi apa semua thing, but it's worth it because you write in the notes, spoke to Dr. such and such, you are not responsible anymore. Betul tak? Spoke to Dr. Hazrin, now he's responsible, I'm not responsible anymore. Because explain the condition of patient, instructions, disuruh buat apa, run IV drip fast, give antibiotics apa semua. Maknanya Hazrin yang suruh kita tadi. Patient kalau mati, his fault, not mine anymore. Faham tak? So that is what you want to do. Don't take responsibilities as a houseman. Jangan buat responsibility. Patient complain of pain, give IV morphine. Wow, bagi ni, wow. Kau buat all the decision. Patient mati, you go and you don't know what to do lah. So jadi statistics. Okay, what happened to people sampai dia jadi penilaian terakhir? There's nothing to do with your theoretical knowledge. Tak. Orang ni tak tahu calculate ESR, fail penilaian terakhir. Tak ada. Tak tahu nak calculate anion gap. Tak tahu kan? Okay. No one fails because of your theoretical knowledge. Penilaian terakhir ni bukanlah bodoh dalam no. Everything to do with attitude. Full stop. Bermakna terbagi ubat yang salah. Maknanya ubat IM dia pergi bagi IV. Run IV fluid yang salah. Orang dah terang-terang tulis normal saline, dia bagi dextrosaline. Tambah pula potassium dalam dextrosaline, mana boleh? Faham tak? Benda macam ni. On call. Datang. Patutnya report kerja pukul 7, pukul 8.30 baru sampai. Dan disappear. Maknanya, mana dia? Oh, dia kirim salam je dekat kawan dia. Datang. Jadilah penilaian terakhir. Betul lah. Lepas penilaian terakhir, ada board dalam MC tu decide, okay, buat. That is, so don't worry about macam easily going into penilaian terakhir. Tapi easily having to extend a few weeks tu memang part and parcel. Jangan kecewa, aku kena extend 2 minggu dalam internal medicine, nak resign dah. Tak apa, 2 minggu nothing to me. Dapat gaji pun, 2 minggu yang extend tu dapat gaji, jangan takut. 2 minggu tanpa gaji, wah. Itu tak berlaku, insyaAllah tak. 2 minggu dia extend pun dapat gaji, insyaAllah. Okay. There is this summer thingy that you asked, my advice is to get yourself attached to a teaching institution. I agree with Dr. Iliana. What do you learn from being in a teaching institution? Not necessarily what you learn from a lecturer, bukan. Tetapi peer group learning is very important. Kalau dapat join team USM and bersama dengan students USM, learn from them and learn from each other, bagi best. I can answer the last question again. Bring something from Russia. Not only the Russian doll. Bring something from Russia. Remember, I need to take one of you home. My cucu suka main benda tu. Okay, so bila deal dengan student tu, you cakap dengan dia, dekat Russia ni kami belajar macam ni apa semua. Wow. The students kat Malaysia appreciate that you actually learn something. Of course you learn something. I mean all the time. You learn something that they don't know. Then they will say, wow, I miss this because kat Malaysia tak ajar benda ni. And they will start talking to each other, buat Facebook status, wow, Russia ni pandai dalam bidang ni apa semua. Then you will be popular in no time. Okay, I've got something else to say. Last point. You know what is important other than becoming a doctor, of course, and being qualified? Your social life. Because this is what you need to take care of. There are more sisters than brothers. You need to plan your life. Who you're going to get married to. When you're going to get married. Who ni semua. Faham tak? Jangan jadi lambatkan doktor, tapi lambatkan doktor wanita yang tak kahwin. Pun tak mau. People, especially the Muslimat, feel that cakap pasal kahwin ni sensitif. Ini dunia. Aku berada masuk syurga daripada kahwin semua ni. Come on. Maknanya I tell my female students, I said, you teringin mana-mana student lelaki, you tell me, saya pinangkan. And I've done this in my life. And the season of getting married is through the year only now. Within 6 and 8 years, they marry each other. And my weekends habis just by going to their wedding parties. Because if my student marry another student, I got to go the female side and male side lagi. Habis lah my weekends. Dan kalau pergi satu student new wedding, satu orang lain kahwin, aku tak, I tak pergi, then they will be angry with me. The dean comes to these people new wedding, don't go to that wedding. I got to really bukan drag lah, I invite my wife and my children to go to this wedding, which is like abundant. Orang kahwin sekarang ni dah tak tunggu cuti sekolah dah. I told some of the brothers, I said there are guys who wanted to get married and the family was not allowing them for the only reason dia tak ada duit. We borrow our money, pinjamkan duit kepada lelaki supaya dia kahwin dengan perempuan. We do that as lecturers. Maknanya just to ask people to get married, to ask people to encourage them to get married. So apa ni? Oh, apalah. So everyone will quote to their parents, I want to get married. Kenapa? The dean got married when he was 22. So macam I got married halfway through medical school. So everyone will quote me, and I got to answer lah one way or another. And then my children got married at 23, 22, 21. So 3 out of 4 of my children are married at a very young age. So maknanya, but you need to budget the marriage according to what you have. Janganlah plumbing dia 7,000, album gambar dengan CD dia RM3,000 apa semua. Why you waste money on this? If duit can guarantee how long you will be married happily, okay, you spend money. But no one yang kata I spend 200,000 to my marriage party, I will live happily ever after, dunia dan akhirat. The money spent does not correlate with whether you're going to be happy or not in the future. So sederhana punya marriage, if you really need to get married and you found the right person, maknanya what I don't know.